Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and all I do is perform cosmetic or aesthetic surgery. I perform lots and lots of rhinoplasties. And a very common question that I have is, can a rhinoplasty affect my breathing? Can it affect my sinuses either positively or negatively? And how do I decide? And what kind of precautions do you take to make sure that I can continue breathing well? Rhinoplasty is a very, very precise procedure, and one of the components of the nose is the nasal septum. That is the cartilage that is on the inside of the nose that separates the two nostrils internally. In patients that have deviation of that septum, oftentimes they will have difficulty breathing because one of the sides of the nose is obstructed. The other side of the nose often has hypertrophy or overgrowth of something called turbinate tissue. So oftentimes people will have difficulty not only where the septal deviation is, but also on the other side where the inferior turbinates become enlarged. When someone performs a rhinoplasty, at least when I perform a rhinoplasty, repair of that septal deviation is actually part of my rhinoplasty because I want to make sure that the foundation of the nose, that is the base of the house, if you will, is straight in order to make the rest of the nose straight. So when I perform a rhinoplasty, I will always fix the septal deviation, and I will always take care of that inferior turbinate with rare exceptions. The first answer to the question is yes, a rhinoplasty can improve breathing, and in my patients, almost always the breathing is improved. In patients also that have a very large nasal hump, that is a bony dorsum hook, if you will, the nose and its breathing can be negatively impacted if that nasal dorsal hump is taken down, but the sinuses are not protected. So always when I take down, or almost always when I take down a nasal hump that is very significant on the bone, I will put in septal spreader grafts, which are grafts that come from the cartilage on the inside of the nose, and ensure that the breathing passages remain open after the rhinoplasty. Occasionally I will see rhinoplasties from other surgeons where this has not been performed and patients will have difficulty breathing. The way to repair that is to go back and put these septal spreader grafts in. So the answer to the question is rhinoplasties do affect the breathing, they do affect the sinuses, but as long as precautions are taken before, that is, the septal deviation is fixed, the inferior turbinate hypertrophy is alleviated, and if there's a significant nasal hump that is taken down, septal spreader grafts are placed, people should be breathing well or even better after a rhinoplasty. So the best way to get an idea about this whole process is to come in for a consultation, discuss your breathing with your doctor, and go from there. Thank you very much.